Monkeypox. Today we are going to discuss about monkeypox. But the question arises, why in 2022 we are discussing about monkeypox? Yes, I'll just let you know why we are discussing about monkeypox. So monkeypox is a rare zoonotic viral disease. What is a zoonotic disease? Zoonotic disease means those diseases which gets transmitted from animals to human beings. So monkeypox remains a very important potential threat for human beings. So monkeypox virus, it's a double-stranded DNA virus and it belongs to orthopox virus. You must be remembering about smallpox. In 1980, it was eradicated worldwide. You must have heard about Republican Democratic of Congo. It was the place where first time monkeypox in 1970 it was reported. In 1968, smallpox was eliminated from Republican Democratic of Congo. But in 1970, first case of monkeypox emerged. So with the fall of smallpox, monkeypox started rising. So today we are discussing about monkeypox because few cases have been reported from UK, from US and Canada recently, and the numbers are rising day by day. So today we should know about monkeypox, the signs and symptoms, the treatment part, the prevention part, and all the vaccines available against this, so that at an early stage we should protect ourselves. As far as transmission is concerned, it gets transmitted from animal to human being, followed by one person to another person. But the question arises here that who is the reservoir of this monkeypox virus? So till date, none of the animals have been declared as reservoir of this monkeypox virus. However, few animals are known to carry this virus, like rope squirrel, tree squirrel, Gambian post rats, dormice and monkeys. So from these animals, if human beings come in close contact, so through blood, through fluid, through cuts, wounds, lesions, this get transmitted from animals to human beings. Similarly, from one person to another person, if those two persons are coming in close contact, or if they are just sneezing or coughing in front of another person, then these get transmitted through droplets. So there are various modes of transmission from animals to human beings, followed by from one person to another person. So coming to the clinical features, what all symptoms and signs do occur in these cases? So initially, all these patients present as a normal viral fever. Fever may be there with moderate to high grade. It may or may not be associated with chills. Patients may present with headache, with backache, with whole muscular pain, whole body muscular pain, with tendency of vomiting, nausea, pain abdomen. Sometimes patients may present with lymph nodes enlargement. So lymph nodes may be tender or may not be tender, but in majority of cases, lymph nodes are painful in character. Later on, after 1 to 3 days, patients manifest with peculiar rash, and this rash is specific to monkeypox. So rash, generally they take place over the faces, over the arms, palms and soles. So extremities and face, these two places are mostly involved in monkeypox. And the lesions, they vary from macule to pustules, and they go in a series. First macule, then papule, then blister, and then pustule. And this monkeypox is self-limiting, self-resolving. The time period is 2 to 6 weeks. In some patients, it takes about 2 weeks. However, in other patients, it takes about 6 weeks. So it varies from 2 weeks to 6 weeks. Now coming to the diagnosis part. So diagnosis, you have to differentiate it from few other conditions like chickenpox. like smallpox, like measles, like other rash associated with fever. But here the peculiar thing is lymph node enlargement, and second is rash, which is very peculiar, specific to monkeypox, and this rash somehow simulates the rash of smallpox. Since the smallpox has been eradicated worldwide in 1980 only, so if you are coming across such rashes, it goes towards monkeypox. So on the basis of clinical features, you can diagnose a case of monkeypox. In case of confusion, in case of doubt, you can ask for PCR, polymerase chain reaction of the body fluid from the vesicle, fluid from the pustules, that is pus. One thing we have to remember here, that PCR from blood, it's not definitive. So better go for the tissue fluid PCR than the blood PCR. Coming to the treatment part, till date not even a single antiviral has been licensed against this monkeypox virus. However, few limited data is available regarding tecovirimat. This is one of the antiviral drug which has been used in those limited areas, but it's not widely used and it's not widely available also. And finally, coming to our vaccination part, as I said earlier also, that it simulates smallpox and it's also a member of same orthopox virus. So the vaccine which was developed initially for smallpox was effective against monkeypox also, but after the eradication of smallpox, the vaccine is no more available worldwide. So today one modified vaccine is available, that is Ankara strain of modified vaccinia. So it has to be given in 2 doses, 4 weeks apart, and it can protect against monkeypox, but this vaccine is also not widely available. It's available for limited use only. So this was all about monkeypox, and before leaving, I just want to mention one sentence again, that don't worry about monkeypox, because monkeypox is a self-limiting disorder. Yeah, it may take some weeks also, but it's not going to harm you very badly. In few cases, it may pose as a threat. Thank you.